I think patients are nervous sometimes to make an appointment with a surgeon because they think if I go see a surgeon, they're going to tell me I need surgery. My name is Joseph Nelson. I'm an orthopedic surgeon here at Dignity Health Medical Group and the Orthopedic and Sports Medicine Institute. I specialize in hip and knee replacements. You don't have to necessarily have that fear because that's not going to be the first option. It's never going to be the first line treatment that you get when you come to my office. I think there are lots of things we can do before we get to that point of surgery. And you may never need surgery. That's the goal. If we can treat you without surgery, that's a double high five. Surgery is only a single high five. You know, if we can get you there, whatever it is to get you to your goal, we will help you get there. My goal when a patient comes in to see me is to help them understand what's going on. Because I specialize in hip and knee replacements, I like to show them the x-rays and talk them through the x-rays, talk them through what I'm looking at, and tell them why they have the diagnosis that they have, and then give them their treatment options. I don't like to dictate or tell anyone what they have to do or need to do, but I always start with the non-surgical first and try to exhaust all options of avoiding surgery if possible. Surgery is a great option. I'm biased, I'm a surgeon, of course, so I do think surgery is great when it's necessary, but I think that jumping to surgery right away is not always the option. One thing that makes me a little bit different is I use robotic technology. All my knee replacements, if I can, I will use the robot. Here at Dignity Health, we have a robot. Her name is Rosa, and she is very helpful in helping us make very precise and accurate measurements and cuts when we're in surgery. I do multiple approaches, but if I can find an excuse to go from the front, or what they call the anterior approach, people have typically will have a shorter recovery time. In the early 2000s, there was an article written about what were the most successful surgeries of the 20th century in terms of getting people's quality of life back. And 2 of the top 3 were hip replacement, being number 2, and knee replacement was number 3. And I have the privilege of being able to offer 2 of those top 3. And I really get to see the change that it brings people